If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. In this episode, I got to speak with Erik Cardenas, co-founder of Zocalo Health. Zocalo Health is a virtual family medicine service designed for the Latino patient. Zocalo removes barriers to healthcare by offering same-day appointments and providing care based on building relationships rather than completing transactions. At the core of this care model is a focus on prevention, primary care, behavioral health, and traditional practices that work together in relationship to support their members' wellness. What a pleasure it was speaking with Erik, first learning about his background and beginnings in digital health, his own personal story with healthcare, and how it inspired him to found Zocalo Health and build it in a culturally competent way. I learned a tremendous amount from Erik, and I hope you do too. Let's get started. I just want to first say, one, Erik, thanks so much for connecting today. I know it's been a long time in planning, but I'm super excited to talk with you today.
I appreciate that. It's my honor, and obviously it's a privilege. So thank you for having me, of course.
Great. So, Erik, you have a long and very impressive career in healthcare, spanning large enterprises like Amazon, down to working with early stage startups. Can you tell me a little bit about your journey and what made you decide to become an entrepreneur and why Zocalo?
Yeah, that's a great question. So I'll start by just saying that my career journey to founding Zócalo Health isn't what I'd call standard or typical. To kind of kick things off, I didn't have a bachelor's degree. I didn't have my undergrad until I was an adult, until I think it was 2020 when I finally graduated. Instead, my career journey took me through, like you mentioned, working for several health systems, working for several successful health tech startups, and obviously getting kind of my dream job at Amazon a few years ago. There's one story that really stands out. Early on in my career, while I was working with the city of Austin, I was really just tasked with a very simple job of helping people enroll in Medicaid. But that's when Hurricane Katrina hit New Orleans, and everything kind of got put on pause. And what I ended up doing was volunteering at the healthcare triage unit at the Austin Convention Center, which was being built for people that were being brought over as evacuees. And while there, I really got to notice that there were a lot of gaps in processes being used by our makeshift clinics. We were using Excel spreadsheets to track patients, and so a lot of problems weren't being noticed, like patients obtaining multiple medication doses by standing in multiple lines. So I got to learn early on just how important digital health tools could be to improve the process of healthcare delivery. And so I really got to continue my focus on my career in developing innovative health technology solutions for real problems that real people face. As I mentioned earlier, I eventually landed a role at Amazon, where I was able to work to grow its presence and expertise in the healthcare space. While at Amazon, there was a Business Insider article that was written and I was featured on, and it really focused on my path as a self-taught health tech entrepreneur. Before this, because of my situation, like with school, right? I mean, I grew up in inner city Houston and didn't have the best access to healthcare or education. I really didn't talk about my journey, and it was in this, honest, interview where I was really able to share my story, and when it ran, it resonated with a lot of people in my community, and communities that look like mine reached out to me. And I realized that at that point, my experience really could stand all on its own. And so I got to meet my co-founder, Marissa, while I was at Amazon. And that's really when I started to really think about just healthcare equity and advancing Latino well-being with innovative, digital health solutions that could really start to bridge those gaps. And so I had all of this experience, and we got to kind of connect over our belief that the U.S. healthcare system just really hasn't adapted to really meet the cultural needs of Latinos. We felt that there was an opportunity. And when we started to dig into the data, we saw that there's over 60 million Latinos in the U.S. today, and that when you start to really dig into some of the that we were able to look at through just access to primary care, we saw that there was a ratio of one primary care physician for every 5,000 to 6,000 residents in predominantly Latino zip codes. And that was something that when you look at also wait times and the average one being 20 to see a doctor, that there was just major opportunities here for us to improve access to primary care for the Latino community. So to address that unmet need, it led to me co-founding Zocalo Health with Marissa, which today we like to just describe Zocalo as a virtual family medicine service that's designed specifically with the Latino patient at the center. And this is where we deliver primary care that blends tradition with innovation and really prioritizes trusting relationships between providers and patients. We really believe establishing those transparent and empathetic relationships can transform the way that primary care is delivered in this country.
Absolutely. I love your background. I love your history. As a side note, I'm from Louisiana. My family was affected by Katrina. I love the work that you did around sort of the post-Katrina aid. And it makes a lot of sense, when you start looking at the data and it becomes very apparent. It no longer is this theoretical injustice or inequities that you hear about, feel sort of, but you can't quite put your finger on it. But when you're looking at the data and you're seeing the discrepancies there, for founders like you, it becomes a call to action. And, you bring forth Zocalo, which is sort of the primary care alternative for Latino community. So I love that. One of the things that I've sort of researched and looked into in Zocalo is that you have a mission that is to build por la comunidad. So I want to know from you, particularly as a founder, what does that mean to you and your team when you're building this company for the community?
Yeah, it's definitely something that's very personal. My career now is 20 plus years in healthcare, and while I've had the opportunity to build some pretty innovative solutions, none of them were really targeted at me, my parents, my family, my community. Where it gets personal is that from a very young age, like I got to witness firsthand the inequalities in the U.S. healthcare system. My parents immigrated from Mexico. I grew up in Houston's East End, which is at the time was a much poorer part of the city. A lot of times people think about Texas Medical Center and you think about oil and gas, NASA, like those things weren't within reach, right? Growing up in Houston. And, we depended on community clinics up until my parents got to settle. I was the youngest. So I think my older siblings probably had it a little worse than I did. But finally, when we did get insurance, I think I was about 11. I got to see kind of both sides of the healthcare spectrum. Early on, I used to have, ear infections all the time. It was hard for my family to get off from work to take me to the doctor. My parents used to have to kind of do the math to figure out if they took off, like if my dad took off and my mom took off, like whose check was going to be shorter. And it was just situations that when we think about healthcare today, people aren't really taking into account. So I like to tell people that the one thing that was really interesting, especially for my family, and I think this is why when we think about the community or la comunidad, these are stories that I think people that resonate with people, is that when we finally got to go to a pediatrician's office with that commercial insurance, we got to see like a waiting room that was not optimized for volume, right? The clinic that we were going to before was like vinyl seats for easy cleanup, duct tape, and as many as you could possibly get into a single waiting room. The contrast was walking into a pediatrician's office where, there was nice furniture, there was a fish tank, and my mom was trying to give me money to pay for the free coffee in the waiting area. And that's when I think now in retrospect, I get to really reflect on how my family had an entirely different healthcare experience than many of the people in America. And this really helped me appreciate the role that culture plays in healthcare, and how these social factors impact how we also consume healthcare. I remember how distraught, how frustrated my family members felt because their voices and their beliefs were really never heard in the exam room as well. Stories that my families and my friends would tell me about their healthcare experience, and how lost they felt trying to navigate where to get care, how to afford it. And when I thought about my family's experiences, I felt like we had to do something for the community, for our friends, for our family. I knew that health technology, technology isn't a silver bullet, is what I want to say. What's really at the heart of impactful care delivery is relationships. And that's what we're trying to build with Zocalo Health. Any technology that doesn't address this critical aspect will miss the mark. Instead, technology should be used to help patients and providers and care teams form more meaningful relationships, especially because Latinos see healthcare as a series of relationships. Family members, friends, and the wider Latino community, they help each other decipher insurance plans. They help each other, by accompanying each other to healthcare appointments and take care of one another, just like my family did.
I want to dig in a little deep there, because there's something that you said earlier about building for your community, and the way you described that, you went back to your experience and how it was impactful to you from a lens of not having commercial insurance to having commercial insurance, and what it was like for your family, the decisions that they had to make in order to take care of their family's health. So as you're building Zocalo and as you're building for the community, what do you believe to be fundamentally true about building in a culturally competent way, right? I think that's what you're describing here as far as building with those experiences in mind. And I'm using culturally competent because it's sort of, what has currently been distilled in the conversation today around building for particular communities.
Yeah, and there's a number of different things that we have to take into account when thinking about what it means to be culturally competent. I think it's a term that gets used quite a bit today, especially with health equity being a major topic in most healthcare circles. For one, we know that a good amount of our health is driven by things that happen outside of the exam room. So not only do we have fewer Latino physicians available, like we make a very small percentage of the clinician workforce. What ends up happening is we see that there are a lot of health systems today that think that in order just to connect with the Latino community, that you just need to translate materials from English to Spanish. And that's not enough. That's where we lose a lot of context. That's where we completely remove the idea that relationships matter and that we have to build trust by really trying to foster something more than just making healthcare very transactional. And this is where we have tried to address this by not just making access to doctors that look like you, talk like you, and think like you, but we've also introduced the concept of using a community health worker or promotora de salud to really be the bridge builder in the relationship and really integrate them into the care team so that they can connect with patients because they are from the community. And so this is something that's really important, because when you get to talk to someone who has the same shared lived experiences as you, you're going to be able to start to establish those relationships. So that's number one, why it's really important for us to build a relationship-based environment that fosters the cultural alignment and competence that's necessary. The second, and I think one of the more important points here, is also around just pricing and the business of healthcare. It's complicated. Transparency in pricing is a big issue across healthcare, and especially more so in primary care. A lot of the people that we spoke to before we decided to build Zocalo Health just had a lot of difficulty understanding things like what a high deductible plan meant, or why they had such high out-of-pocket fees that they were having to pay. And this is something that really posed a problem to the community, because what it did is it forced people to just either forego care or find these low value patterns of care, which meant either going to an emergency room or leaning on informal networks of care that may also not address like the root issue. And this is where we felt that it was really important for us to think about our solution in a way that would allow us to bring, again, the innovation in tech that a lot of people like to think about in the startup world, but bridge that with the tradition of the Latino community. And that's where I think cultural competence comes into play in how we deliver primary care to the Latino community.
I think that's probably one of the best descriptions I've heard around really distilling into what culturally competent care can look like for a particular community. It's multifaceted and it's multifold. And I love the description that you just gave. So I'm curious, if I were a user of Zocalo, can you walk me through what kind of experience on your platform I could expect to receive?
Yeah. So our process, we're very up, and our initial hypothesis is that we need to give people more access to primary care. And I don't think that the typical patient today, the typical consumer is looking for primary care. No one says, oh, I'm shopping for primary care today. So what we did is we set ourselves up to offer virtual services. Right now we're available in California. We'll be available in Texas and Washington before long. And the idea is that we want to provide you with access to a community health worker, the promotor de salud, and physicians. And because we are virtual, we are limited in the scope of practice, right? There's certain things that we can do virtually that some things can't be done virtually that can be done in person. But I think what we've really come to learn here in the last 2 months is that even if we can't take care of you, if one of our doctors can't resolve the issue, we are really finding that there is a lot of value in the community health worker connection. That if someone comes in and has a specific issue, we are being a really valuable resource to our patients in helping them find care in their community, in helping them find a clear path, like walking them through applying for any kind of insurance that they may be, eligible for. When there's a specific social service that they might need. One of the things that just recently I can share is that we helped an individual who couldn't afford their prescription, even though they had commercial insurance. We wanted to make sure that they didn't have to make the trade-off between paying for a prescription or paying for their light bill. And so by finding out a little bit more about them and some of their personal situations, we could help them find resources that could help subsidize the cost. Therefore, they're not making that difficult trade-off between a utility bill or a prescription. And so right now, people can come to us for urgent care. We'll connect you with a physician same day or next day. And in the situation where we might not be able to provide that service, our community health workers are there to help navigate you and make sure that you find a facility or a clinic that can help you with your specific need. So our goal here is to ultimately expand beyond virtual in the future. So my hope is that in the near future, we can start to deliver care in person. And hopefully that's by meeting you where you are in your community, maybe in the home, and perhaps even in brick and mortar clinics that we can open sometime in the future.
That's great. That's great. I love that you're combining sort of systematic care with also personal touches and services, really drilling into not just what a consumer or patient comes to you with, but what are their sort of life circumstances and how does that all come into play. All I have to say is that I am a fan of Zocalo. I think you guys are doing amazing and incredible work and really making an impact in the community. And I think you're doing it from obviously a personal lens, but also really attacking it in a health equitable way that's considering all perspectives of the person. which has been generally lacking in healthcare.